I'm sorry, I just don't see recovery as someone being able to take a shower. I don't see recovery as someone, being able to just not hurt themselves. I don't see I think the bar is just so low. And I think part of the reason the bar is just so low is because there's lots of people who aren't responding to treatment as usual and standard of care.
At the 2024 Bazooki Group Metabolic Psychiatry Retreat, we gathered leading clinicians, researchers, and individuals with lived experience, all working together to accelerate the integration of metabolic therapies into mainstream mental health care. I had the privilege of speaking with Nicole Laurent, a licensed mental health counselor and ketogenic therapy coach who's making an invaluable impact in the metabolic psychiatry field. From publishing groundbreaking case studies to transforming individual lives and creating a ripple effect by training other counselors and coaches, she is shaping the future of mental health treatment and driving better patient outcomes. In this discussion, we explore Metabolic Mind's THINK+SMART Framework and what true recovery really looks like. After nearly a decade of struggling with bipolar I disorder symptoms, despite often being in a state that traditional psychiatry might define as recovered, I finally found real healing through metabolic therapies. Through the THINK+SMART framework, many others who've been on a similar journey share their stories, offering wisdom, motivation, and inspiration to those seeking healing. Let's hear from Nicole as she shares her clinical perspective on THINK+SMART and the crucial role it plays in helping patients achieve true, lasting recovery.
Welcome to Metabolic Mind, a nonprofit initiative of Bazooki Group, transforming the study and treatment of mental disorders by exploring the connection between metabolism and brain health. Thank you for joining us on this journey.
Good morning, Nicole. Thank you so much for joining me this morning. It's great to have you here.
It's great to be here. Thank you for having me.
So today we're going to be talking about the new model we recently launched at Metabolic Mind, THINK+SMART. Mm-hmm. And I want to start with asking about the think portion of that model. So that is therapeutic integration of nutritional ketosis. Mm-hmm. I'm wondering from your perspective, what role do you think ketogenic therapy plays in terms of impact on patients as well as transforming psychiatric care?
I think that use of a ketogenic diet depends to some degree on how severe symptoms are for them and what they're trying to treat and what's going on for them. So sometimes when we just implement just a few of these really wonderful metabolic therapies that you have on the site, sometimes that will improve mood sufficiently enough and people will feel so much better and just do so much better. But then there's sometimes where I think a ketogenic diet can really be foundational and really important for people to adopt those types of metabolic therapies additionally.
Yeah, that's absolutely true in my opinion as well. And I was wondering, in terms of the SMART model that we're launching, that's more of a holistic approach, looking at the various interventions that we can do that improve metabolic health, things like sleep and movement and rebuilding purpose and community. What are your thoughts on that model and the way that we're planning to share patient experiences that people can draw inspiration from?
I think that's really important. I think that, the ketogenic diet is very much kind of a very powerful tool that we use in the treatment of mental illness. But I think that all of those pieces really matter. I mean, we hear these really amazing recovery stories of people using the ketogenic diet, but often there's additional metabolic therapies that people will implement to keep their mental health going and to continue to see improvements when they start to feel more energy and start to feel better. I think that those are all really important pieces. I don't think psychiatric recovery happens in a vacuum. I think that that act of self-care or that ability to implement self-care as a daily activity, and to start integrating social back in, to really kind of relearn what we're capable of and who we are as well people, I think is a really important part of the recovery process.
Yeah, I'm so excited to talk to you about this because of the pioneering work that you've done in this field, really for therapists to understand how to help people implement metabolic therapies. And I think sometimes people might get the misconception that you just help people do ketogenic therapy, they go into remission, their life is all roses now, everything's wonderful and beautiful. But I think what you do is a lot more complex than that, because once people start to see a remission of symptoms, in a way, that's when the real work starts, because people have so many identity issues, so many different things to work on so that they can move forward in their lives following the remission of a serious mental illness. So I'd love to hear your thoughts on that.
Yeah, it's really a beautiful thing to watch unfold as a clinician. I could probably talk with you guys just about that at some point. There's, as symptoms start to improve, people are kind of afraid to hope. And so you just very gently don't tell them they're getting better. You let them discover that themselves, honestly, because it's really about them integrating those improvements into their experience and their existing schemas of being people with mental illness who have been suffering sometimes for decades. And so the work that therapists can do to help validate and be with people on that journey to wellness, and behaviorally, we're so well versed in helping people make lifestyle changes, right? I mean, that's a big piece. And to go on that journey towards what I think of as self-actualization and empowerment. So therapists are beautiful, beautiful friends, I guess, on this journey, are professionals on this journey. And yes, people, I think it's almost impossible to have serious symptoms and debilitating symptoms and to not have that affect your sense of self, or for people to start to take that and integrate that information in about who they are and what they're capable of. And so there's a big piece when people are truly recovering from mental illness. And when I say the word recovery, I don't mean what we've been calling recovery in the psychiatric literature. I'm not talking about a reduction in symptoms that makes it possible to just barely function in life. That's not the word recovery that I'm seeing, and that's not the word recovery that I'm using. So true psychiatric recovery means a rebuilding of all these things all of these behaviors that you have on this beautiful website that Metabolic Mind has made around this modality of giving people ideas about how to integrate and bring back in these therapies into their lives. Not therapies, well, metabolic therapies, yes, but also the social is really important. I see this a lot. People have gotten very used to having very small lives because they have been so debilitated or suffering so much from chronic symptoms. When you're in survival mode, you're not going to go out and take dance lessons, or you're not going to go out and meet those new people, or you're going to not feel like going to dinner with that family event. And so that's a beautiful example that you have on your website of where people need to kind of start to explore and rebuild their capacity for that, because those capacities do in fact improve.
I couldn't agree with you more in your definition of recovery. As someone who for a long time was on medication and could be considered recovered in the traditional sense, being able to function and work and live independently, yet I never felt like I was fully myself. It wasn't until I discovered metabolic therapies that I was able to totally reclaim my life and my health. And I think that's an exciting opportunity that this uniquely offers. And I can really relate to once you have that. It's interesting because I think it can come to a point where it's really post-traumatic growth, where you're glad for the lessons that you've learned and the discipline that you've gained, through implementing these therapies. But it's really an opportunity I've heard people refer to it. Yesterday, we had this amazing lived experience panel where Laurent Kennedy from Living Well with Schizophrenia spoke, who you've coached, and she just owes so much to you and how you've helped guide her through this process. And it's really incredible.
Lauren's the easiest person ever to work with. So I feel like I'm getting way too much credit for all of the changes that she made. She's, highly motivated. And just, she's very representative of the people who come to me. They are ready to do what they need to do to feel better. And they do beautifully. So.
Mm-hmm. And I'm wondering, seeing Lauren's approach, I feel like I can relate to some of the things that she did, because she was a person who I think takes sometimes an all or nothing. She was like, I want to do all the metabolic therapies. I'm going to go all in. But there's so many different personality types out there, and people might find metabolic therapies at very different points in their journey. Maybe there's someone who early on, I struggled with self-medicating as a negative coping habit, drinking too much and smoking, and I had to quit all of that before I'd be ready for metabolic therapies when I eventually discovered them. So I'm thinking people probably come to you with all sorts of other issues happening, whether it's intense stress in their life or substance abuse issues. And how do you kind of guide patients in beginning this process, since there's so many different areas they might have to work on?
Yeah, so primarily I work with people on implementation of the diet, but all of that stuff ends up coming up, because a lot of the things that you just described are metabolic inhibitors, metabolic stressors, and people do end up over time fine-tuning in like all the ways that your descriptive website kind of talks about for different metabolic therapies. So yes, those things absolutely do matter. And people, in my experience, people tend to feel better able to address them. I feel like on a ketogenic diet, when your brain is working a lot better, self-directed behavior is easier. Saying no to things that aren't conducive to your long-term brain health or how you want your life to be is easier. It's so much easier to do this work when your brain works a little bit better through metabolic therapies. And I think people are always quite surprised by that. But that is what I see. And I also see that when there is therapy, that's, like there's stuff that metabolic therapy is not a well, it's a miracle. How do I say this? So it doesn't fix everything. Like you can, you might have lifestyle things that you have to still address, and you might have relationship things that you need to address. And I'll say, sometimes when people are struggling with their mental health, their relationship system becomes accustomed to their functioning in a particular manner. And then when that person's recovering, that can be disruptive to the relationship because it changes the dynamics in the relationship. Suddenly existing in that job is suddenly unbearable now because you want to just expand. And so there's so many wonderful things to kind of explore.
Yeah, wonderful challenges to have, right, as people's condition improves.
I call them celebratory toes in the water, right? Where they're like, where they're just like, oh, I think I can do this thing. And, let's do the thing. Put your toe in the water and see how it goes. And then they just kind of expand out.
Yeah, it must be a beautiful process to watch from your perspective of someone's clinician. And I think this must be part of what drives your passion for the field, because you hear all too often from therapists about like patients who just never are getting any better, and seeing them deal with, recovery as we currently define it and kind of this suboptimal living.
Yeah. I'm sorry, I just don't see recovery as someone being able to take a shower. I don't see recovery as someone, being able to just not hurt themselves. I don't see I think the bar is just so low. And I think part of the reason the bar is just so low is because there's lots of people who aren't responding to treatment as usual and standard of care.
That was another thing we heard in the lived experience panel yesterday from Eric Rogers, who is now in remission from chronic depression. And he talked about his days working as an optometrist and how he'd go to work all day and then he'd go home directly to the couch. Mm-hmm. And that was his life. And I could relate to that so deeply. It's like, yes, I went to work, but I wanted to go straight to bed afterwards. Yeah. And I was on medications with all these side effects. And to call that recovery, how hopeful is that?
The bar is too low. So this is an exciting field.
Yeah, absolutely. So I think it's easy for those of us who have experienced this firsthand to just want to make this our life mission, right? Because it must have been so incredible for you as a counselor to see people really fully getting their lives back.
Yeah, it's kind of almost indescribable. And they have trouble describing it too. They have trouble putting into words how different they feel, how much improvement they're experiencing, and the ripple effects of what that means to them in their lives. And I would say the people in their lives, because we aren't all just individual people, right? We're mothers, we're fathers, we're uncles, we're aunts, we're all these different things to mentors. We're all these different things to all these different people. And our capacity and our ability to show up and really interact and really be present, you got to have a healthy brain for that.
I think that's another reason we get so fired up about the urgency of the work that we're doing. I've heard people in remission saying, I was not able to play with my young children before I found this therapy. And those are precious years of their lives that they're never going to get back, right? And so people don't want to wait more than a decade to feel like the scientific research fully validates, this form of treatment.
Nor is that in society's best interest, right? I mean, these are formative, like with that example, these are formative years with children. And so having parents that are well is really important for society. And so people's ability to access this before it becomes treatment resistant, I think is really important. I think this should be talked about early on in treatment and early on in symptoms, and it should be given as an option, because people really are, when they go to a psychiatrist, they trust that psychiatrist to be an expert in their field and to know about the most recent cutting edge, how can I help you interventions. They trust these psychiatrists and these doctors and these therapists to talk to them and tell them about all the different ways that they can feel better, of which there's an evidence base. And as we know, ketogenic therapies have an evidence base. And so what I hear from people is they feel betrayed that they were not taught, this was not talked about earlier on in their illness process. And to some degree, of course, many therapists didn't know about it, right? Many psychiatrists don't know about it. And we're, of course, doing something about that. But I think that everyone who sees patients and everyone who sees clients around this who are, and I would say who are nervous about suggesting something that does not yet have an RCT, I would say you maybe need to rethink that, because that is not what your patients are waiting for. They trust you to tell them about these therapies as an option. They trust you to be educated about these and to be able to talk about these in knowledgeable ways. And I would very gently suggest that it might be much more unethical to not bring these therapies to their attention earlier as part of your treatment of them than it is to suggest something that doesn't have the perfect RCT with the numbers that you're looking for.
I don't quite understand the double standard that exists in terms of resistance to showing ketogenic therapy as an option, because we know from more than 100 years of research in epilepsy that it is a safe intervention. So really, testing out the efficacy, it just makes me think about certain medications and practices of polypharmacy, where people are given these combinations of pills that there's never been an RCT on. And not only do we not know if that's going to be effective, we don't know if that's safe.
Right. I think that There's that for sure. There's also the piece where I think that prescribers and the psychological field and the psychiatric field in general have different paradigms that they work from. There's a paradigm about a diet and the idea that a diet is probably not as powerful as a fancy medication that's had, different levels of efficacy figured out about it. I think that prescribers have a hard time understanding the ketogenic diet because the word diet is at the end. And what I think really needs to happen is I think they need to start to understand the ketogenic diet as this really powerful intervention that will stop seizures when all other medications have failed. And when their patient comes to them and says, I'd like to know about the ketogenic diet, they're thinking, oh, that's like a vegan diet, or maybe that's like a Mediterranean diet. And that's going to improve your nutrition, which is going to improve your health, which is, sure, go ahead and do that. That's great. But they're not understanding that the ketogenic diet has medication-like effects. And I think that, I think it's going to be important that we start to kind of talk about the ketogenic diet through the lens of those medication-like effects and the different mechanisms that we already know from the research literature that are in play that are providing therapeutic effects. So I think that that's a piece of it, is that people have existing cognitive schemas about how they see the world. And I think we're just bumping up against those. I know that in the psychology world, I feel like there is no bigger advocate than a psychotherapist and a psychologist for patients, potentially. They are huge advocates. And so if we just find a way to explain this therapy to them and to prescribers and to medical doctors from an existing cognitive schema, from an existing paradigm, they're going to get it. And they're going to be able to talk about this with their patients in the same way that they talk about medications, hopefully with better informed consent,
Absolutely. I could not agree with you more. So one thing I wanted to ask you about just in a little more detail is the track component of our THINK+SMART model. I'm wondering what kind of things you have patients track during their implementation of metabolic therapies.
Well, there's a lot of different metabolic markers that can be tracked. And some of that has to do with the sophistication of the clinician that you're working with and what they're comfortable evaluating. So when I pull treatment teams together, often the doctors or the medical providers have a certain idea of what they'd like tracked, but often they don't. They don't track the metabolic pieces. So what I like to track is, I like to get fasting insulin, of course. I like to get fasting blood glucose, but there's things such as like waist circumference that people can measure. And I really like mood assessments. So if you're working with a therapist, or if you use like an app, for example, can be really useful, like Dailyo, I like for people because it helps them kind of track their mood and they're able to see their improvements. They're able to get data about how they're doing, and they're also able to share that information with their doctor. And then taking in that information about how well they're doing or not doing kind of helps with what we talked about earlier about them being clear about how they're doing in their recovery. And so those are just some of the things that I track in my work with people.
Yeah.
And I will say, though, that a lot of people I work with do totally have normal metabolic markers. So if you have symptoms, don't just assume because you don't have a waist circumference issue that you don't have a metabolic issue in your brain. And so these are not the only things to track. Symptoms are really important. I would love to see things like a DEXA scan done, if it's possible. Sometimes you can literally Google DEXA scan near me, and it will tell you places that provide DEXA scans. They are relatively inexpensive, at least in my area. It's around $100, $120. But that can be really nice for people as a before and after. So that they can really kind of see improvements in their metabolic health around the loss of fat percentage, and increase in lean muscle mass.
It's interesting. For a while, I've been trying to build more muscle, and it's kind of a gradual process. I find jogging like naturally enjoyable, but strength training is a little harder for me to do. But I worked with a trainer for a little bit, and she was incredibly like lean and muscular and so fit. And she was telling me that by BMI, she was technically obese. And I thought, what is wrong with this system? And we're telling people to like look at that as an indicator of health.
Yeah, my understanding is they're going to be getting rid of that from not from the medical literature, but it's just not going to be used that much anymore. So there's much better markers, but it is, it can be, if you're not doing a lot of resistance training and you're just implementing, like, for example, ketogenic diet, for example, and you're not adding any exercise in yet, you're just getting going, BMI can be kind of helpful and motivating if you just want to use it to kind of look at those improvements. If you do have a lot of weight to kind of lose or to work off of because of side effects from psychiatric medications, you can watch your BMI score go down and celebrate that for sure. But if you are working out diligently and you're doing resistance training and that BMI is not kind of going in the direction that you imagine it's supposed to go, don't panic. There's so few things to panic about. That is definitely not one of them. And remember, panic lowers your ketone levels because it causes metabolic stress. Yeah.
Yes, absolutely. So I think one of the key things that you have people doing in terms of tracking their mental health symptoms is just that if they do see, for whatever reason, there's a change and maybe they're experiencing more depression again, that's something that they can then reflect on what might be going a bit awry in either their diet or other
start
issues like stressors
and start problem solving. And this just goes into other videos that Metabolic Mind have kind of talked about how after a period of wellness or doing a little bit better, if there's suddenly an increase in symptoms or symptoms that are different, right? These mood assessments or, and again, it doesn't have to be the ones the therapists give you, it doesn't have to be a PHQ-9 or a GAD-7, which are different mood assessments. It can simply be a great app that you use to track your mood and gives you a little graph and lets you see things. I think those are very valuable and helpful in metabolic therapies for all the reasons I've talked about.
Nicole, I just can't tell you how invaluable I think your work is to this field as someone who's really, even though I couldn't find counselors who understood metabolic therapies, they played a really important role in my recovery because they did help me with things like identity and how to grow now that I was doing so well and free of symptoms. So I know firsthand that therapists can be really impactful in someone's journey, putting their illness into remission. And I think that you're really paving the way for therapists worldwide, to be able to help patients through the work that you're doing, offering training to other clinicians. And I'm just so inspired by everything you do and want to thank you so much on behalf of all the patients, whose lives are changing as a result of the work that you're doing.
Thank you so much, Hannah. Thanks for having me.
Thank you.